evidence. Nielsen and Baumgartner did a study. Again, this is kind of a seminal article for the apical negative pressure. We needed to establish that endovac or apical negative pressure, how does it stand up to the needle irrigation? And the reality is that they tested cleanliness at 1 and 3 millimeters from the apex and really didn't see a tremendous difference up to 3 millimeters. So that means that classically we've done a pretty good job of cleaning the top 2/3 of the canal. Of course, we recognize that the apical third, or the last third, is the most critical, the most difficult to clean, and the most important. And what they found with endovac is it was significantly cleaner at 1 millimeter from the apex. So that's a very significant finding. This was a study by Desai and Van Himmel, which showed essentially everyone wants to know, well, is it going to go past the apex? If I'm pulling it down to the apex, do I have a risk of going past? And this study showed that apical negative pressure did not extrude irrigant after deep intracanal delivery and suctioning of the irrigant to the full working length of the canal. So this study stands to show that this technique does not allow extrusion of the solution. And I'd like to give an example of this. So if you consider the fact that the whole reason and the only reason, due to everything we've discussed tonight, that solution would even be at the apex is because of this high-speed current force, this pulling of the solution to the apex. So let's say the cannula were to get clogged, for instance. Well, at that point, there would be no suction to pull the solution down. There would be no solution apically. So this is really the idea of why this is something you can use predictably, because once it reaches those suction openings, it flows right in, and it's unable to then go anywhere past there. And then clinically, as far as results, so what this study by Gandim et al. Looked at was, what are the clinical implications? And what they found was, I think, very important, that a cleaner canal equals less post-op pain. I think that's pretty logical. And so with this, they found that really up to full working length, that this was safe to use to irrigate your apical third. So we've overcome our apical vapor lock. We've overcome the inability of instruments to really truly clean apically. And now we have our chemical debridement happening right at the apex. So very exciting.